So the health system's doing very well. All of our hospitals are Leapfrog Grade A hospitals. Leapfrog is a national organization that rates the quality of hospitals. For the first time ever, we are at the 75th percentile last year in terms of patient experience scores. And that's really sort of the ultimate quality measure. If the patients and your customers are very, very satisfied, then that means in all likelihood you're doing an excellent job. So to be at the 75th percentile during times of such stress, we felt was a great accomplishment. The medical group has grown tremendously now. We have about 1.5 million patient visits each year. In terms of primary care patients, we have over 200,000 active primary care patients in the panels that we see. And likewise, we've continued to recruit new physicians into the group and into the area, and there's an enormous shortage of doctors nationally. If you want to do that, you really have to have a residency program. We've always had a great family medicine residency, a great obstetrical residency, a great transitional internship, and in the last several years we've added emergency medicine to that mix, which is very, very helpful. And this year, for the first time, we started internal medicine. So years ago, hospitals and health systems used to have their own nursing schools. Most of them closed during the 1980s and 1990s. Riverside never closed its nursing school, and in fact has grown what used to be called the College of Health Careers and is now renamed the College of Health Sciences over the last year to include not just nursing, but also radiology technicians, MRI and CAT scan technicians, ultrasound technicians, medical assistants, and starting last year, respiratory therapists. We end up hiring about 60 plus, sometimes 70% of the people that graduate from the College of Health Sciences into the health system. So this is now the 1-year mark from the time we initiated the relationship with the University of Virginia. They're a world-class academic medical center. One of the issues they have is they have an enormous number of clinical trials. It's over $450 million in annual research funding. And so working with them will allow us to grow our own research base and be able to offer clinical trials and the latest advancements to patients in a more convenient and in a broader way. We also have some clinical programs we're developing with them. Cardiac surgery is now a joint venture, and we've seen a doubling of our surgical volumes in cardiac surgery and thoracic surgery since that joint venture began. UVA is now holding transplant clinics here at Riverside facilities. They're one of the best transplant centers in the world. And so initially the patients are seen here, evaluated here. They would get their transplant eventually at UVA and then come back here for follow-up care. So the health system continues to do somewhat better than most comparable health systems financially. It is a struggle. It's a very narrow margin business. We spend about 99 cents out of every dollar that we bring in. But that's better than some health systems that spend $1.05 for every dollar they bring in. That slight margin allows us to reinvest in the future, and we are doing better than most. It is something that is going to continue to be stressed over the next couple of years as we bring the new hospital in Smithfield online, but that's on track. That's on track. It's doing very well, and it's slated to open in January 2026. Philanthropy has never been more important now because every dollar that comes in goes directly to the benefit of our patients and our team members. And so it's never been more important than ever, the philanthropic efforts